pet parents, and welcome to another episode of Natural Pets TV. I'm joined by Heidi Nevela, Dr. Liz Bales, and Dr. Patrick Mahaney. Thanks for joining us. One of the most common things I hear from cat parents is skin issues, skin issues, skin issues. But there's a lot of different types. Can you fill us in on what you commonly see and how you determine what some of those issues are? I'd like to start that with Dr. Patrick.
Sure, Robert. Well, the skin is the body's largest organ, so it's going to be affected by so many different factors. What goes into the cat's mouth, what's happening in their environment, what's going on in their overall health status. There's a variety of ailments that can occur inside the body that actually manifest with problems in the skin. Hyperthyroidism. When cats are overweight or obese, sometimes there's too much cholesterol in the blood, and that prevents good perfusion of the skin with blood. So there's a lot of things we have to really consider in the whole workup. In the environment, we have problems inside the house, we have problems outside the house. There could be seasonal allergies or non-seasonal allergies. There could be fleas or ticks or other kind of biting insects that cause inflammation of the skin. From a nutritional perspective, there could be deficiencies in fatty acids. There could be food allergies as well. There could be actual bacteria, yeast, or mites in the skin. So there's actually so many different layers that pet owners have to consider with what is going on with my cat's skin and why is it occurring. So if there ever is a concern that my cat has a skin problem, it's really important to address that with your veterinarian.
And so I think when this patient comes to us, it's important to understand we need to do a workup.
Absolutely.
We can't really just guess what's going on. You just described a whole host of really complicated problems that could be happening. And the first thing to do is to try to get a diagnosis. That sometimes is harder than it might seem. And we would use a variety of different tools to do that. I think when you're talking about the skin being the largest organ and endocrine problems, lots of different factors can be involved. Basic blood work, yes, just to assess the overall condition of what's going on inside the cat is a really important thing. And then we would get to what's exactly happening on the surface of the skin. So a good flea comb to make sure. A lot of times you just can't see the fleas by parting the hair and looking. You really have to have an assertive flea combing to find a flea. In addition to that, we would want to take a look at the abnormal area itself, whether that be what we call an impression smear, where we just take a microscope slide and kind of smush it around on the part of the skin that's having a problem. And then we put that through some special stains and look at it under the microscope. In addition to that, to get deeper under the skin to see what's going on, some conditions require that we see what's happening in the top skin layers themselves. So we actually take a scalpel blade and do a scrape of the skin. And so sometimes we actually have to get to where we can see some blood to find what we're looking at, which yes, can be alarming, but it's what we need to do to look. And then we take that material, put that on a microscope slide and look at that under the microscope. And sometimes we need to take it a step further and even take biopsies of the skin, where we put the cat under anesthesia or sedation and actually cut out a small piece of skin that we send to the lab to have the veterinary pathologist look at and see if they can give us information from that. So skin conditions can require a lot of diagnostics and tests to find out what exactly is going on. It's hard to treat something if you don't have the diagnosis, and skin is a great example of that.
Absolutely. And when it comes down to it, once you do achieve that diagnosis, then you can go the route. You could go the route of nutrition, you could go the route of better environmental modification, like maybe you actually don't see fleas on the pet, but there is a problem with fleas. Flea saliva is extremely allergenic, and even a single flea bite can make the cat itchy all over their body. So it's really important that cats that have suspected allergic skin disease are on regular flea control. But there's a lot that we can also do from a supplement and herbal perspective too that a lot of owners don't really think about, and so that's important to really bring into the mix along with diet.
I think nutritional platform is usually the first conversation that I like to have with someone when they're talking about maybe some alopecia issues, or cats get acne around their mouth for a variety of reasons. So it's up to the pet parent what they're feeding, but there's a lot of other things that cats require in their diet that they may not be getting through a synthesized diet. So the omega-3 and 6 that you talked about, pre and probiotics, digestive enzymes that are well tolerated by cats are things that I suggest. And then when you're getting more specific into like the common acne, people are
feline pustular dermatitis.
Right. And there is something. Thank you, acne, but it can become more serious.
Yes.
So there's an herb that I like to make a suggestion for, called Sangre de Grado, because it actually can be worked on the surface topically or taken internally. still think internally is usually the best route to go because there's usually residual inflammation and other things causing it. But why it's an interesting herb to try is it's antibacterial, antifungal, antimicrobial, anti-inflammatory, all those, like great antipanel. It's got it's a neural anesthetic, so it actually it helps deal with pain, nerve pain, which can be the case. Good for abscess, internal for ulcers, leaky gut syndrome. So there's just a lot of applications besides topical. And when you're talking about balancing gut flora and kind of limiting inflammation, it's also it's good for that. But I have a question for you.
Sure.
Because this is something that I've had a conversation with many people and I don't know the answer to, is it's common that cats that are spayed, the hair does not, or the fur does not grow back in that area where they've been shaved. So why is that, and what could be some of the reasons and approaches for dealing with that?
Well, I think that there's never one answer, right? Mm-hmm. So a couple of things we would want to think about are, was it really that the hair didn't grow back? Or is it that the cats were moving the hair? Cats don't have a lot of great ways to express pain. And one of the ways that they can do that is by over-grooming. So if it may be from the spay itself, maybe not. It could be coincidental that they're experiencing some sort of abdominal pain, and that's the way that they're self-soothing. Okay. It could be unrelated to pain, and that cat is experiencing environmental stress. This is something interesting to think about because spay happens around the time, depending on where and when you've had your cat spayed, but of social maturity. So that cat is actually seeing the world differently than they did as a kitten. Now they're a juvenile, if you will, they're a teenager, and they're experiencing environmental stress differently. And that's another way that cats will self-soothe, is to over-groom. So those are two reasons why maybe the hair is being removed, didn't grow back. What else do you think?
Also, spayed cats tend to become overweight because they don't have the same hormones that help to maintain lean body musculature and reduce fat. So when they become overweight, a lot of the place it manifests is on the underside of the body, and the skin can become pendulous. It can rub against the ground. It swings back and forth. Yep. A lot of times there is a reduced blood flow there just because it's hanging down so much it can actually constrict the blood vessels. And so there's those components that could lead into as well. And also you have this scar that form right there, and therefore tissue kind of forms around it and hangs down, and that's where you get that swinging belly. So there also could be reasons where actual internal organ issues, endocrine problems, as we mentioned. When we say endocrine, we mean glandular issues, hyper and hypothyroidism. Hyper is much more common in the cats. As they become overweight and obese, that just puts stress on all body systems, and blood doesn't flow around the body quite as well as it should. So you could always think about supplementing the cat. The thing I reach for right away is a fish oil-based omega fatty acid supplement, ideally something that's low flavor and low odor, so it's easy to disguise in food. A lot of foods come with it already supplemented, but I don't love the fact that dry foods might have fish oil put into it because it oftentimes goes rancid at room temperature, it becomes unpalatable, and can actually cause health problems. So it's really interesting that point that you bring up.
When you talk about obesity and skin disease in general, I think exercise is fantastic to get the blood circulating and to decrease anxiety. One of the major reasons why, regardless of what skin condition your cat might have, it's less likely to heal with stress. Stress causes the body to release cortisol, which decreases the ability to heal no matter what the cause. So getting your cat some form of exercise really can help with both obesity and with anxiety.
Normally when I am talking to someone who has this very issue, I tend to make suggestions not only for the omega-3s, the digestive, the pre and probiotic, an immune, whether it needs immune modulation, upregulating or downregulating, a gentle hepatic support, a gentle cardiotonic depending on the age, but also something that nourishes the skin, the connective tissue, the very thing that we're talking about. They lose elasticity in the skin, and they lose blood flow volume and a lot of other things. So you can actually add in kind of like a nice custom mix for these very issues and address nutritional, maybe what's going on physiologically and emotionally, because you can certainly add that component as well.
With blood flow promotion as well, a lot of what my practice is chronic pain management in older cats, and there's a lot of times reduced blood flow to joints and to skin, and so that's a place where obviously there's going to be a skin problem on the outside, there can be pain on the inside, so I do laser treatments. And also, as much as the cat will tolerate, I'll do hands-on work. We're doing range of motion and acupressure massage, which really helps to function to get the lymphatic system flowing better too. And that makes the cat feel better. Generally, they're happier. And then also the laser the laser helps to promote blood flow to a particular site. And really that gets blood moving all over the body. Like what Liz mentioned with exercise, you're increasing your cardiac output. You're pushing blood to places where it doesn't go as often to provide nutrients, to help to remove toxins. That also helps your lymphatic system to drain so your immune system works more optimally. So it's really important that we think about exercise with cats. And this isn't like taking your cat for a jog. This is maybe like taking a toy or taking something that contains a food treat and throwing it across the room so they have to get into it. Using a laser pointer, putting them on a leash and harness and getting them outside for some controlled outdoor play.
So there's both dealing with the specific problem that you have a diagnosis for and overall health and support to try to manage that ongoing problem.
So if you're working with your veterinarian and you're not able to resolve your cat's skin issues, it's really important to also think about taking that next step and having a consultation with a veterinary dermatologist.
Absolutely.
A veterinary dermatologist is a veterinarian that only works within the realm of skin and might be more experienced than your veterinarian in how to manage certain skin conditions, might even know about treatments that aren't really readily available to the typical general practice veterinarian. So ask your vet for a referral to a veterinary dermatologist if your cat skin problem is not being resolved.
Absolutely.
A lot to know, so make sure you're working with an expert that you trust. Thanks for joining us here on Natural Pets TV. Hey folks, thanks for joining us here on Natural Pets TV. So many great topics, so many wonderful experts, but we want to keep the conversation going in the comment section down below. Let us know what you think. Let us know what you want us to cover in future episodes. And if you want more information, you can always reach out to us at petworldinsider.com, or for more information from our guests, you can get that at, for Heidi Nevela, natureofpetswithaz.com, for Dr. Liz Bales, nobowlcat.com, and for Dr. Patrick Mahaney, patrickmahaney.com. Thanks for joining us, and we look forward to seeing you again soon.